I have my set for a DNC procedure or a dilation and curettage procedure. In this procedure, a patient will be placed in a supine or lithotomy position. Skin prepping usually includes both abdominal and perineal, including the vaginal prep with insertion of a Foley catheter. I'm going to be following my DNC count sheet. A few of the instruments that would be used during a DNC is first, a few of the accessories would be the basins, which I have here. I have my basins here. I also have a septo suction or Toomey suction here. Those are used, it's a sterile item used to deliver irrigation solution at the operative field. I also have here Raytech 4x8 sponges. I have the needle box, and this is used during surgical procedures, usually kept on the back table to hold and organize suture needles, scalpel blades, and hypodermic needles. I have my lap sponges for open abdominal procedures or even orthopedic procedures. This is one of the instruments that will be used in this type of procedure, a Cushing tissue forceps with teeth. It's commonly used when closing the dural layer for craniotomies and spinal cord procedures, but also used in DNCs. Another instrument is the tissue forceps without teeth. The Cushing tissue forceps with teeth. It is used on tissue, fragile tissue. The Adson pickup with teeth. It's usually used when closing skin with sutures or with staples. Also, an instrument that may be used is a bayonet forceps. Here I have my Yankar suction. The suction line, it connects to wall suction and sterile suction tips of choice. Another instrument that may be used during a DNC is a laparoscopic biopsy grasper with tooth. The single tooth teneculums, usually used on the cervix. Double tooth teneculum, often used are the uterine curettes to scrape the inside of the uterus due to retained contents or excessive bleeding. The Pratt cervical dilators, these are used to dilate the cervix opening to accommodate instrumentation. Hank cervical dilators. Heger cervical dilators. Also Gelpi retractors. Weighted vaginal speculums for self-retaining retractor. The closed side vaginal speculum. It's also known as a duckbill. And here is another open-sided vaginal speculum. This allows for the removal of speculum while teneculum and or hysteroscope remain in place. I also have a specimen cup with the solution and needles here in my set. Ruler and skin marker. We also have here our sutures, needles and sutures, and the syringe. I did have a few of the instruments here to show. Oh, and my labels. This one would be the Metz scissors. the towel clips non-penetrating, Mayo straight needle holder, scissor, number 7 blade, Kelly forceps, and a curved Mayo needle holder. This is the way that we would have the bag table with our instruments, our supplies, following the count sheet for a DNC procedure.